making sure that our community is as safe and healthy as possible. So I'm going to present an overview of coronavirus COVID-19. The Department of Health wants to assure consistent and updated information is shared in this rapidly changing situation. So I'll be using a standard presentation, but highlighting key points relevant to the recent changes in our community. There's an overview. I will be using the official name of COVID-19 to discuss novel coronavirus. Next slide. This slide summarizes the state of Florida and the Department of Health's response to COVID-19. You can see some of the trigger points that have caused the increase in activity in our state, including the cases in Florida, the declaration of public health emergency and response, and then just to also let you know that the Nassau County Health Department has actually had an internal incident management team related to COVID-19 since January, and we've been meeting closely with Nassau County Emergency Management and other community partners since then. Next slide. This is not new information with regard to COVID-19. Everyone knows, I think, that it started in China and has spread to multiple countries, and we've seen person-to-person spread. So again, not new information, but it's important in terms of your goal to make sure that our community is educated with regard to this. The most recent statistics, there are over 113,000 cases. This is yesterday in the world in 109 countries. 647 cases in the U.S., already outdated, 21 cases in Florida, and most importantly, as announced last evening, there is a case of a Nassau County resident, a 68-year-old male, who has exposure related to travel. Next slide. Again, we've gone to transmission and symptoms, which is fine. I just want to emphasize that there are increasing cases statewide, but it's important to distinguish, as the governor did, between travel-related and known contact exposure versus community-based transmission. We do not have community spread based upon the single case with an identified risk in our community. Let's see. So, transmission symptoms. Can we go back one slide, Martha? Okay. We're going to review this. A lot of this information has already been sent out on multiple websites. We do encourage our residents to look at the Florida Department of Health and the CDC websites for correct and accurate information, and rely on these resources versus non-scientific resources, and also to make sure that we're not spreading non-factual information. Knowledge is a very powerful tool to reducing personal risk. So, how is COVID-19 spread? This is the slide. There we go. It's spread through respiratory droplets from an infected person who coughs and sneezes, and it's spread among close contacts. We define close contacts as within 6 feet, all right? As with most respiratory viruses, people are most contagious usually when they're ill. So when we investigate who is at risk for COVID-19, we look at factors like how close is the space and how long did an individual spend time with a person who was ill. Excuse me. A close contact is therefore defined as someone who spent a prolonged period within 6 feet or 2 meters of a person who was ill or was exposed to secretions, for example, a healthcare worker or a family caregiver at the time. Remember that definition of a close contact, because I think it will reassure our community in terms of who is really at risk. Next slide. Symptoms can appear 2 to 14 days after exposure, and the most common ones are fever, cough, and difficulty breathing. And as been reported, about 80% of the cases are mild, and most do not require hospitalization. Treatment and testing. Excuse me. Next slide. The CDC recommends that people who think they may have been exposed to COVID-19 call the county health department immediately and self-isolate. This is because there is no specific antiviral treatment for COVID-19, and there's no vaccine to prevent disease. People who do get ill with COVID-19 should receive supportive care and to relieve their symptoms. And this slide highlights an important recommendation on what people should do if they think they've been exposed. Specifically, they should self-isolate and contact the county health department. I want to reiterate again what exposure means. It's defined by the specific status of the outbreak. So again, we do not have evidence of a community spread at this time. So the individuals who are exposed are likely to have been exposed through relevant travel or contact to a known COVID-19 case. Next slide. The governor talked briefly about testing. It's currently available, and we are using it at the Department of Health for people who are symptomatic and at risk. In other words, they are ill and they have risk criteria. This is a brief history about how the tests have developed. Initially not as much availability. CDC developed it Most of the testing was done through the Bureau of Public Health Labs, and now we've had expansion with regard to private commercial laboratory testing. The healthcare providers in our community were provided an algorithm yesterday with updated guidance based upon CDC and the Florida Department of Health of who gets tested, who's recommended for testing, and the laboratory options that they have. Next slide. So, risks are changing over time, but the Department of Health continues to put out guidance. Again, currently in Nassau County, there may be some concern about public risk associated with a single case. So it's important for us to understand what a health department does to reduce public risk. The county health department isolates the patient who is positive. We determine the travel and exposure history and who the case had close contact with when they were ill. This is called contact tracing. Then the people who have been exposed are notified by the county health department and given instructions on self-quarantine and isolation observation for symptoms. With a single Nassau County case, we have already reached the identified contacts in our community and provided instruction on quarantine and isolation and monitoring. There are some general instructions for the public. Again, if those based upon your risk criteria, you should consult with the health department and your provider and self-isolate. Please call your healthcare provider ahead of time to tell them of your risk factors. And remember, you can only get COVID-19 from someone with the disease and who's ill. But avoid contact with others. Do not travel while you're sick. Cover your mouth, nose, and cough, sneezing, and often wash your hands, wash your hands, wash your hands. Prevention is our next important strategy. Again, I'm not going to spend a lot of time with this. I think many of you already are familiar with this and hopefully not only are aware of the message, but sharing the message with others. Next slide. Washing hands with soap and water, using hand sanitizer with at least 60% alcohol, avoiding touching your face, eyes, nose, mouth, and avoid close contact with sick people, and then most importantly, stay home when you're sick. Travel advisories, again, I will go quickly through this because this is rapidly changing, and what I tell you right now will probably change. So I would encourage you to look at the CDC and Florida Department of Health websites for the most recent and accurate travel advisories. Let's go ahead and go to the next slide that deals with past travel advisories. We'll go to, again, keep going. Public health monitoring, I've kind of reviewed this already. The health department does get information on travelers from Iran and China, and there's been definite guidance that's been sent out with regard to other now impacted areas in our world, and also such things as cruise ships. These international impacted areas will continue to change. Please check with the Department of Health and CDC websites. And again, on returning travelers, follow guidance with regard to self-monitoring, social distancing, and immediate reporting if you become ill. Again, the monitoring process, you're to monitor symptoms for 14 days, self-isolate for 14 days, avoid travel using public vehicles, gatherings with groups of people, and exclude yourself from work, school, public spaces, and then provide the normal education on preventing spread. We've already talked about washing your hands, covering your cough. So what have our cases and other folks been told when they're suspected or confirmed with COVID-19? This is what we tell them. Immediately isolate at home or a healthcare facility. Do not participate in public activities such as work or school. Only travel by ambulance, private car. Avoid public transportation. Always wear a mask when around other people or pets at home. Always cover your cough and sneezes and clean your hands often. So this case has been given that information. All right, the next slide, again, is to reiterate that limited person-to-person spread in the community, as referenced in this slide, really refers to the United States, not Nassau County. We are going to see more cases likely to be identified, and the limited person-to-person spread that's occurred is usually among household members or nursing homes, as we've seen, but everyone can do their part to prevent the spread of COVID-19 and other respiratory illnesses. We encourage everyone to visit these websites. On the Department of Health website, not only is there information that's often updated daily with regard to case counts and other information, there is a a call center that is open 24/7 that you can ask for general information. Again, for the health department, if you think you are exposed and have at-risk criteria, we want you to call us, right, so that we can consult with you about the need for testing or at a minimum isolation and other education. The CDC also has a lot of information with regard to sector-specific information that's very valuable and constantly being updated. So use these resources. So the kind of questions that we've gotten today, we've received many questions about the single case's circumstances, and we appreciate the desire to have more information in order to determine your potential contact to a COVID-19 case. However, it is important to balance the privacy of individuals with the responsibility to disclose information that will really help to protect the public. So the Health Department strives to protect the identity of the individual affected by COVID-19 while ensuring information for public health is still available. So as previously discussed, the single Nassau case has travel-associated exposure risk, and the close contacts to this reported case have been identified, notified, and received instruction on isolation and monitoring. There was very rapid self-isolation, reporting, testing, and now notification. We do want the public to contact us, and our phone number is 904-875-6100 if they believe they meet the exposure risk, which is primarily currently travel to an impacted area with widespread community transmission or close contact with a confirmed case. So before I turn it over to Director Foster, I can answer questions from the board.
Dr. Sodell, thank you so much for the update. I know we're all receiving a lot of questions from the public because they want to know. There's been reports in other jurisdictions that may give more or less details, and we certainly know that in respect to right and privacy of individuals who may be impacted. Is there more specific information that you can give about the Nassau case? Apparently it may not be, but you mentioned it's travel related. Can you identify maybe where the individual had traveled to or from?
We are not really permitted to share that information, again, because it's not really pertinent in light of the fact, as the governor has stated, all the cases that were reported yesterday were travel associated. So whether they traveled to A or to B, the important part really is the second part of that statement about this case, and that the case is isolated and will remain in isolation until cleared by the health department.
Okay. Great, thank you. I know you've answered a lot of the questions I think we all have as far as what response you and your department is taking and undertaking, and what the community can do. There's a wealth of information out there on a number of websites and what have you, and through your department, and you've given your contact information as well. Is there anything else we need to know at the moment?
I think just stay informed, practice good infection control, and if you're ill and you think you've been exposed, certainly contact the health department. And again, if you believe you have been exposed to COVID-19, make sure that you tell either whoever you're going to go see for care about that exposure.
Okay. All right. Thank you very much. Okay. Thank you. Director Foster, yes. Welcome. Thank you for being here.
Yes, sir. Thank you, Mr. Chairman and Commissioners. Thank you for the opportunity to come and speak to you. This COVID-19 coronavirus has really put in sharp relief what emergency management is. Emergency management, specifically Nassau County, but throughout the entire profession, we are a coordinating and a support entity, and this really puts in relief that part of our job. We are staying in and have been in contact with the Florida Department of Health in Nassau, and listened in to conference calls with Florida Department of Health Tallahassee repeatedly for the last 2 weeks, two plus weeks. The Florida Division of Emergency Management is conducting conference calls on a bi-weekly basis, twice a week basis, and have invited all the local emergency managers to listen into that call and get information not only from the Department of Health, but the Division of Emergency Management also. We have been coordinating with the Florida Department of Health, Nassau County, on almost a daily basis to find out the current status, find out what they are doing, and to provide them with what we are doing. And that is exactly what we're doing. We are coordinating with the response agencies. We are pushing out the information from the Department of Health and the CDC through the Department of Health. We are providing our partners, be it governmental, county, municipality, nonprofit, school district, with the information that's coming out of the Department of Health. We actually conducted an exercise on Monday using a different form of a virus, flu, to kind of test our plans in government. We had a lot of participation from municipalities, different levels of county government, and walk through the process of responding and how we would respond, how we would coordinate, how we would support if something broke out like what's going on now. It gave us an opportunity to test our plans and revise our plans to make sure that we have an effective response to that. And we will continue to do that. Like was spoken earlier, we are conducting a call with our local partners every Friday. And we will continue to do that, and if the circumstances deem it necessary, we can also do that more than once a week. Any questions?
Okay. Thanks, Director Foster. Before I open up for questions, I do want to thank you and your staff, and I know county staff and all of us, and the health department is going to be working very closely with you and everyone else. I think it's important to understand, I think everybody knows this is a dynamic situation, changing daily, and we will stay on top of it. And I just want the general public to know that the basic guidelines are out there. Just heed the advice of our professionals, health professionals and emergency management advice, and know that we're here to do our best to protect them, and we'll do everything that we can. With that, I'm going to open it up to my fellow commissioners to see if they have any questions. Commissioner Taylor.
Thank you, Chairman. Director Foster, thank you. Dr. Seidel, thank you for your presentation, for your briefing. Understanding that social media doesn't always provide a lot of factual information, I know that this is something we need to take serious. We need to remain calm, and maintain individual responsibility. But really, when it comes to the information that's being released and being put out, so we know that it's coming from the reliable source. We want it coming directly from emergency management, correct, and the county health department, right?
Right. That's the direction that we are pushing out to people is if you're wanting to get information from emergency management, it's going to be the information from the Department of Health, and we actually direct them to go directly to the Department of Health's website and phone number.
And I only ask because, you come in here today, there were a few things that were put out there that, just from individuals that appeared to not be 100% accurate.
Right. We run into that in any kind of response to any kind of disaster that's taking place, and it's no different in this one. And we're continuing to push that message out that it's real easy to get the factual information. It's a one-source stop with the Florida Department of Health. So we're going to continue to push that message out.
Anyone else? I think the message is clear that, what's been said from not only our state and federal partners is that we prepare and not panic. That's the message that we need to get out. I appreciate the local media being here today and getting our message out about Nassau County. And this time, any members from the public that have any questions, I'll open it up to the public at the moment. Any questions? I appreciate our local agencies and partners being with us today and coming out and hearing what the latest update. We'll continue to monitor the situation, and we'll go from there. Yes, sir.
Just a quick question. The gentleman who was diagnosed locally, are we able to tell, was he diagnosed, and this was last night I'm hearing, that he was diagnosed at the testing center in Jacksonville?
Dr. Seidel. I'll go to Dr. Seidel on that.
We don't release that information.
Okay. Fair enough. Thank you.
Thank you.
Also, did he have any other underlying health issues before he was tested positive?
Again, we don't release other information.
Dr. Seidel, you mentioned that the contact history had been traced. How many people were traced through that contact history?
Again, we don't release that information. Because we don't really feel like it's pertinent to the public. They just need to know that this person has been isolated, and all their contacts that they've been given have been identified, notified, evaluated.
And forgive me, if you said this already, do we know how long that person will be isolated as a protocol? Will it be 2 weeks?
Typically.
2 weeks.
Can you speak to the severity of his conditions at this point, or is that something that can't be answered?
Again, that's private protected health information.
And we understand.
You mentioned
Go ahead.
restrictions on nursing homes. We can go to them and see people there. What will the county be doing with that? Are they going to screen people coming in, check their temperatures? Like, how are they going to know that these people shouldn't be staying at the nursing homes or home care facilities?
Yeah, great question, Dr. Seidel. How will we monitor
So again,
that?
that was just announced as the new governor's executive order. Those facilities are actually regulated by Agency for Healthcare Administration, so they would follow those policies and guidelines.
I know there's more questions than answers that we can give. We know that, and we just ask for your continued monitoring and appreciate you being here and letting us get our message out. So thank you so much. Yes, sir.
Yeah, just one final question. May fall under the realm of something you can't answer, but is there any indication as to at which point this person may have contracted the virus and when they actually tested positive at a last time?
So again, that's personal information, but I would say that it follows the typical case that we've seen in COVID-19, just that I referenced before, with regard to symptoms developed within the person.
People that live in this man's neighborhood or work with him, should any of them be concerned about this?
As we talked about before, we do a contact tracing, which identifies people who meet the criteria for close contact with an individual for a long period of time and therefore are at risk, and we have reached out to those individuals.
Doctor, I'm going to ask you your expert field gut. Where we're at right now, if you had a crystal ball, if you dare, I know it's a loaded question.
So
What do you
know
think?
that I'm not going to answer that.
Okay, fair, but we have to ask, right? But it's sort of like, what's your gut about where this is going from here? Not about him in particular, that gentleman, but.
So I don't have a crystal ball.
Okay.
One last question. Go ahead.
I have this question for Dr. pointed out. I would hope there's no cost associated to patients getting this test. There are no financial obstacles to people getting tested.
That is a good question. For the Department of Health, for anyone that meets our testing criteria by CDC, cost will not be able to test. But again, that is not necessarily everyone who wants to test is a test. We follow CDC guidelines on that, and we don't have this criteria. Cost will not be able to complete that.
One final question, and Dr. Seidel, you might not be able to spend too much time on this, but it's been reported and discussed lately about the longevity of the virus and how it lasts. And we're coming into the spring season and summer, and environment's changing to a warmer climate, so to speak. So is that beneficial to us moving forward?
I think, again, the science is still out on that, and we're early on in trying to find the information. And so I'm not aware of any definitive evidence that there's going to be a definite change in that.
Okay.
We will hope.
Yeah, right. Okay, we've just been listening to that. Okay, that's all we have for today. Thanks again for coming out. Really appreciate it. Okay, and we're adjourned. Thank you.